Hi, I'm Kelsey Bilsback, Principal Scientist at PSE, and I'm here to talk to you today about the Methane Risk Map, a new tool you may have heard of. This tool allows anyone in the US to look at where a methane super-emitter event might have posed a health or safety risk to their community. So let's take a look at the all events view. This is where we map 1,300 emissions events across the US. And while we're starting with 1,300, we expect to be adding more events to the tool as more data come online. And across all these events, we see that over 99% of them pose a risk to human health. So what does that mean? Let's look at a case study in Colorado, close to where I live. So what we're seeing here are peak benzene concentrations. And how we find those peak benzene concentrations is we combine data from methane sensing satellites and aircraft with site-specific gas composition information and run a regulatory model to look at modeled concentrations coming out from an emissions event. And those site-specific gas composition information come from PSE's state-of-the-art gas composition database, which includes over 8,000 regulatory documents. And so the red line lassos what we call the health risk boundary. And so that's where benzene concentrations reach levels that exceed state regulatory benchmarks and therefore pose risks to public health. Another key feature of the tool is that we look at who is impacted. And so we have an estimate of the number of people within that health risk benchmark and the number of sensitive facilities. And those are things like childcare centers, daycares, and hospitals. That's the methane risk map. The data on this tool that's science-backed can be used to support health protective planning, energy policy, and air quality regulation. So whether you're a parent, a policymaker, or a regulator, get in touch with a PSE scientist at mrm@psehealthyenergy.org to learn more about how you can use the methane risk map in your work.